Hey everyone, today I want to talk to you about the effects of caffeine on your pregnancy, your baby, fertility, and when you're breastfeeding. So to start with, let's take a look at what caffeine actually is and what effect it has on us as adults first. Caffeine is a central nervous system stimulant. It's the world's most widely consumed psychoactive drug. Examples of psychoactive drugs are also caffeine, alcohol, cocaine, and cannabis. Psychoactive drugs are chemical substances that change the brain function and result in alterations of things like perception, mood, consciousness, cognition, or behavior. Unlike many other psychoactive substances out there, it is legal and it's unregulated in nearly all parts of the world. Once consumed, caffeine is really quickly absorbed from the gut into the bloodstream. From there, it travels through to the liver and it's broken down into compounds that can affect the function of various organs in the body. But that being said, caffeine's main effect generally tends to be on the brain. How it functions is it blocks the effects of adenosine, which is a neurotransmitter that relaxes the brain and makes you feel tired. Now, normally, adenosine levels will build up over the day, making you increasingly more tired and then causing you to eventually want to go to sleep at night. Caffeine, however, helps you to stay awake by connecting the adenosine receptors in the brain without actually activating them. Caffeine tends to exert its effects really quickly. So to give you an example, the amount of caffeine that you would find in, say, one normal cup of coffee can take as little as 20 minutes to reach the bloodstream and about 1 hour to reach its full potential. Because caffeine is a stimulant, it increases your blood pressure and your heart rate. Now, both of these are not recommended to do during pregnancy. Caffeine also increases the frequency of urination as well. So this causes a reduction in your body fluid levels and it can lead to dehydration. Remember, it's really important to stay extra hydrated when you're pregnant. Your increased blood volume and also the fluid that's needed to create and replenish amniotic fluid for your baby is crucial to a healthy pregnancy. If we think about how caffeine makes us feel for a moment, you get this buzz, right? Like a sense of increased heart rate or energy levels. And if you have too much, you can tend to be a little bit jittery. Luckily, we as fully mature adults have the ability to break down the toxins, the caffeine, in our liver and dispose of the waste after a few hours. However, think about your tiny little growing baby. Everything that you eat and drink crosses into the placenta, into your baby's bloodstream. Although you may be able to handle the amounts of caffeine that you feed your body, your baby simply cannot. Your baby's metabolism is still maturing and it does not have the ability or the liver function capabilities to fully metabolize, break down the toxins such as caffeine. Their tiny little heart is forced to increase in its heart rate and it doesn't have the ability to process and dispose of that caffeine the same way, so it causes these toxins to build up in their system. Any amount of caffeine can also cause changes in your baby's sleep pattern or their normal movement patterns that you'll see later in the stages of pregnancy. Remember, caffeine is a stimulant, okay? So it can keep both you and your baby awake. It's important to also point out that caffeine can inhibit the absorption of essential vitamins and minerals such as iron and calcium and magnesium. It's already a challenge during pregnancy to get those nutrients from the foods and the supplements that we take. So with a high percentage of pregnant women already iron deficient, the last thing that we want to be doing is blocking those nutrients from reaching you and your baby's bloodstream. Too much caffeine and exposure throughout pregnancy has been found to lead to a lower birth weight in bubs and health conditions later in life. So that's when you're pregnant. What about when you're trying to fall pregnant? Well, if you're trying to get your body into a healthy shape in order to conceive, then of course it makes great sense to limit your coffee intake to perhaps just a cup a day. However, if getting pregnant is proving to be a struggle for you or you're suffering from infertility, it's best to cut coffee out altogether. We all know that caffeine can increase stress and anxiety levels, which can inhibit fertility. But for women trying to conceive, coffee also has other consequences as well. Caffeine can decrease the flow of blood to the uterus, which can interfere with implantation. Too much caffeine can increase the risk of blood clotting and also miscarriage. Now, knowing that caffeine can cause fertility problems, some women will naturally switch to decaffeinated coffee in order to try and enhance their fertility, which is fine. However, all coffee, be it regular or decaf, is acidic, and it can make the body and the cervical mucus too acidic for sperm to thrive, and so therefore can affect conception. Several studies have shown that coffee, even decaffeinated coffee, can diminish fertility. So some studies have linked coffee to miscarriage, and some have also linked it to a low sperm count. So it's important to ensure that your male partner is doing all he can as well to improve your chances of a healthy conception. So what about breastfeeding? Okay, look, I understand that if you've cut out coffee for the last 9 months of your pregnancy, by the time your baby arrives and you're just this tired new mum, the allure of a morning cup of coffee is at its absolute peak. And it's not unusual, but it's not a problem either for most women. But it's important to be aware that what this can do for your breastfed bub. So things to look out for and to consider. When caffeine enters into your bloodstream, a small amount is passed along through to your baby through your breast milk. Most babies aren't affected by this, but some sensitive little bubs may have a reaction and be extra fussy or wakeful after drinking milk with traces amounts of the caffeine in it. So you may even find that because it's too difficult for bub to break down the caffeine, they might find they have an upset tummy, wind pains, or general digestive upset, which, if you're unaware of these symptoms being related to the coffee, could leave you as a new mum scrambling for answers to your bub's distress, maybe putting it down to colic or wind or a bad sleeper or teething pain, and it really actually could be down to your coffee. Keep in mind that the concentration of caffeine in your breast milk will actually peak about 2 hours after breastfeeding. But look, I'm not here to just hate on coffee. I enjoy a good cup of coffee as much as the next mum. Caffeine is found though in lots and lots of different foods and beverages. So it's just really important to remember that these combined all contribute to the maximum daily intake that's recommended. Here's a rough guide, for example. The amounts of caffeine that are expected in, say, a 240 ml, like a small cup of coffee or beverage, is, say, an espresso up to 720 mils, barista style coffee 300 mils, yerba mate 120 mils, energy drinks 160 mils, black tea up to 120 mils, and soft drink up to 40 mils. Even little bits of chocolate and things like that. So all those yummy little snacks and things, they all carry their own varied amounts of caffeine, and the maximum daily recommended intake is 200 milligrams. The bottom line is we recommend avoiding all drugs like alcohol and caffeine during pregnancy. It's just a small window of time which you can prioritize your bub's health and development to give them the best chance of a healthy start to life. That's why at maternity, all of our blends are 100% caffeine free, and they're loaded with antioxidants and other nutrients which are designed to help support a happy, healthy pregnancy and beyond. So if you're looking for a natural way to boost your energy levels and replace that daily coffee, have a look at our activity blend. It's the perfect solution. It's our energizing and immunity boosting blend, and it's there to help give you that natural lift, that natural pep me up, and protect both you and bub from harmful free radicals and to help you get through the day. If you do still really want to continue with your daily coffee, then try to just limit to 1 small cup a day, and trust me, the weaker the better. So try and water it down a little bit and make sure that you're drinking more plain water to ensure that you're not becoming dehydrated. Thanks for tuning in, everyone. I hope that that's helped provide a little bit more knowledge around the topic so that you can continue to make more informed choices to support your pregnancy. Bye for now.